All right. Well, good morning, everyone, and thank you for being here. We appreciate your attendance this morning. My name is Alexia Green, and I'm a professor of nursing at Texas Tech and Dean Emeritus, but I'm actually here today in my role as co-leader of the Texas team, Advancing Health Through Nursing. The Texas team, which you may not be familiar with, is a statewide coalition composed of a diverse array of stakeholders, a number of whom are actually here today, and we thank all of you for being here today with us. A list of the team members can actually be found in your packets, but I would like to take this opportunity to introduce an important team member who's been working with us for the past 3 years, State Representative Donna Howard and Shalene Walker, her staff person, have been actively engaged with the team since its inception. Our goal for the team is to transform the health of Texans through nursing by implementing the recommendations of the Institute of Medicine report, The Future of Nursing, Leading Change in Advancing Health. One of the recommendations we support is the more efficient use of advanced practice nurses. Those nurses are also called APRNs. Advanced practice nurses are one of the keys to delivering high-quality care to our state of Texas. Highly educated APRNs must be a part of any solution being discussed in our state to make health care accessible to Texans, more and more of whom are having a difficult time finding a primary care physician to treat them. We've all been reading and hearing in recent weeks about the shortage of primary care physicians in Texas. This is nothing new, as Texas ranks 47th of 50 states in supplying primary care physicians. An estimated 132 counties have a shortage of primary care doctors, and 29 counties have no physicians at all. As you can see from the map, 185 of our state's 254 counties are designated as medically underserved, while another 46 partial counties are medically underserved. We don't have enough physicians to treat either urban or rural areas. This situation will only worsen in Texas as our population continues to grow and our citizens age. It also will be compounded by federal health care reforms, which are expected to add an estimated 6 million Texans to an already overburdened and inadequate system. It is in this critical environment that the Texas team is here today to release a report by Dr. Ray Perryman, a noted economist in Texas, that shows that more fully utilizing APRNs will deliver a tremendous benefit to the state's economy to the tune of billions of dollars and tens of thousands of jobs. Those economic benefits will only grow over time. The Texas team believes more fully utilizing APRNs also will deliver more health care to Texans. Dr. Perryman is here with us today to go over the specifics of his report. We've included a major portion of the report in your packets, and the full report with appendices that include breakout projections localized for cities, counties, and regions can be found online. After Dr. Perryman discusses his report findings, another member of our Texas team, Commander James Dickens, himself an advanced practice RN, will talk about the current unnecessary restrictions on APRN's practice and how those would need to be changed by lawmakers in order for Texas to have a more functional healthcare system and to realize the economic benefits outlined by Dr. Perryman. Now I'd like to introduce Dr. Perryman, founder and president of the Perryman Group, an economic and financial analysis firm that's headquartered in Waco. Dr. Perryman, thank you very much for volunteering your time and your resources to research this report as a member yourself of the Texas team. Dr. Perryman?
Well, thank you very much. Appreciate everybody being here. And Donna, especially appreciate you being here and everything that you do to try to make the lives of Texans better all the time. And we need more leadership like that. It's a pleasure to be here. I got involved in this. I've been involved in the healthcare industry in one way or another for the past 30 years or so, first studying it, then on a major board and a number of other things over the years. And it's become increasingly obvious to me that we have to do a lot of things differently to make the system work, because right now we simply don't have enough people. There was a study last week that was released that talked about the physician shortage in Texas and what it is now, what it's going to be in the future. We don't have enough residency slots to fill. If we had the bodies in the medical schools, we don't have enough residency slots to fill all the demand that's out there. as Alexi pointed out, the state's growing. I grew up in a little town called Lindale, Texas, about 12 miles from Tyler. It's become an overnight success since I left, but when I was there, it had about 1,200 people. And we had a doctor's office, a dentist's office. We had a couple of drugstores. We had grocery stores. We had gas stations, a school district. We had a pretty nice, functioning little small town. The state of Texas adds 1,200 people, the population of the town I grew up in, every single day to our population. We're adding 1,200 people. And the average age of that population is going up. And the demographic mix is shifting in a way that you have more healthcare needs out there rather than less. There's all kinds of challenges we face, and we simply don't have the resources to do all the things we need to do. So anything that kind of can promote efficiency is something I get interested in. And after the Institute of Medicine study came out, Alexia and a few other people talked to me about it and convinced me to get involved with this group, and it's been a real pleasure to do so. We try to take a very simple approach here. Basically, we looked at some academic studies that told us how much of the health system could be more efficiently delivered by advanced practice nurses. And as you can imagine, anyone who does academic study in this area, patient outcome and patient safety is paramount. So everybody that does this is very, very conservative. We took those numbers, and we took the acuity level at which they judged, okay, you need to make sure you have a physician in place, and we doubled it. So basically, we said, let's color way inside the line of what nurses can do. And then we said, because Texas is so spread out and everything, let's say we probably won't do it all that well. We'll mess up somewhere. So we said, let's give it another 20% down from that. So what we're basically taking is 80% of the capacity of advanced practice nurses today, after I've literally moved the line way over in terms of patient outcomes from what professionals who actually know something about healthcare, where they put the line, I moved it over even further. And when we did that and looked at the cost savings that would come from that, and those are cost savings to employers or cost savings to individuals, and said, okay, that money, they're going to do something with that money. We know very well that kind of what they do, because we've got a lot of history and information on that. What economic impact would that have? And the answer is, given the size of the economy today, about $8 billion a year in gross product and about 97,000 permanent jobs. That's a very, very significant economic impact. The number of jobs basically doubles if I run it out a few years into the future, because obviously, as I say, the needs are growing, the demand's growing, everything else is growing every year, and so the numbers get much larger over time. As Alexa pointed out, we've presented them by county, by city, by region, and that sort of thing, because once I got into this thing, I got pretty enthusiastic about it, and I kept going and going and going and finding more things to do. I think I finally gave you all a first draft on Christmas Eve or something. I mean, I was really into this thing. But in any case, that's only part of the story. I mean, we need to be doing this because we need to use our resources, both public and private resources. The resources the state has to use to provide health care. The resources we all have to pay for health care. We need to use those resources as efficiently as we possibly can. And this opens up a way, and it shows a very important economic benefit. But what it doesn't show, which I think is even more important, is if we use our resources and use this resource better, we can actually deliver a lot more health care. And we can provide that person whose only access today is to walk into an emergency room with a sick kid. The most expensive door in the most expensive building in the hospital system is the only place they can go. We can provide services to those folks in a much more efficient manner. We can provide more services. And when people are healthier, they're more productive, their absenteeism is down, their work lives are longer. You get all kinds of other benefits that are not even reflected here. So I think we've just scratched the surface. But the bottom line is, I know that anything like this is controversial, and I certainly understand that, and everybody has their own ideas about it. But we don't have enough doctors. We don't have enough nurses. And the gap's widening every day. So we don't have any choice but to try to use the resources we have more efficiently. There's no other way to get there from here than to do that. And I think this effort is commendable. I'm totally in support of it. The study has a lot of detail in it, but I think those are the high points. And at that point, I will just leave it there, answer any questions you have at the end. And are you talking again, or is James talking?
I think James.
Okay, James, come on up here, sir.
Thank you, Dr. Perryman. I'm Commander James Dickens, a member of the Texas team and an advanced practice registered nurse for 12 years. I'm a senior program officer for the Office of the Assistant Secretary for Health in the Dallas Regional Office, U.S. Department of Health and Human Services. My comments here today are my own and do not reflect the U.S. government or any of its operating divisions or the U.S. Public Health Service. As you can see from Dr. Perryman's report, more fully utilizing existing resources, APRNs, to help meet the state's health care shortage not only is good common sense, it is also good economic sense. Some of you may be wondering, what is an advanced practice registered nurse? Would using them more fully treating patients be safe? The answer to the last question is absolutely yes. The term advanced practice registered nurse covers 4 groups of healthcare professionals: nurse practitioners, certified registered nurse anesthetists, certified nurse midwives, clinical nurse specialists, and a majority, about 63% of nurse practitioners, 63% of those advanced practice registered nurses are nurse practitioners. Chances are good that you've been treated by an APRN at your own physician's office. Here in the Capitol, legislators, staff, and others have received excellent treatment by an APRN. Tim Flynn, who has practiced at the Capitol since 1992. Tim has treated governors, lieutenant governors, speakers, senators, representatives, and countless staff and Capitol visitors over the past 20 years. And as I've said, I've been an APRN for 12 years, and as a member of our uniformed services, I've been deployed to Afghanistan multiple times, providing care and training. Our U.S. military entrusts APRNs to care for our men and women in uniform by practicing to the full scope of their education and expertise, without any unnecessary restrictions. Patient care is not compromised by the use of APRNs. A wealth of data and studies throughout the past 4 decades show that APRNs provide safe, low-cost, and high-quality primary care. Currently, Texas law grants APRNs prescriptive authority under a site-based model. It was first enacted in 1989 and reflects 20 years of add-on amendments. It began with sites serving medically underserved populations, then physician primary practice sites, and facility-based practices were added, and finally, alternate practice sites. Now each site has its own set of restrictions. This result is a hopelessly complex model that has little to do with quality of care and actually reduces access to care for all Texans. Texas cannot maintain the current site-based model and expect APRNs to effectively contribute to Texas's need for more providers, particularly primary care providers. Nursing has proposed a change that better promotes access to safe patient care, yet retains significant physician involvement while permitting APRNs to diagnose and prescribe more efficiently. Nationally, 17 states already have adopted some form of the collaborative agreement model we're proposing today. Those states are shown on this map in yellow. Texas nurses are not asking for the model adopted by 18 states and the District of Columbia, shown on the map in green, that allows nurses to prescribe medications without a physician involvement. Specifically, Texas nurses are proposing a model which requires 2 things of an APRN in order to prescribe. First, the APRN must be credentialed by the Texas Board of Nursing as qualified to prescribe. This is the same as the current law. Second, the APRN must have a collaborative prescriptive authority agreement with the physician or physician group that provides for consultation with and referral to the physician or physician group. This proposal allows the advanced practice nurse to more fully be a part of the healthcare provider team. The nurse is not attempting to replace the physician. Instead, the proposal would permit APRNs to be better able to practice to the full extent of their education and national certification. More importantly, I think it increases Texans' access to care. Our state has thousands of underutilized qualified healthcare providers, APRNs, advanced practice registered nurses. In conclusion, we believe APRNs and should be partners with physicians and other healthcare professionals in the redesign of the healthcare system in Texas. We should be working together on a common goal to make sure Texans, both now and in the future, have ready access to qualified healthcare providers, the APRNs, who can help them maintain their health while reducing the cost of care. Thank you for being here today, and now I'd like to invite any questions.